So this isn't going into the clinical aspects of it. You guys already know that. It's how to leverage what you're doing. How to get the best results for your patients so you have really good patient retention. Okay, so we'll go into it now. Everything, everywhere, all at once. I love that title. I stole it from one of our doctors. He said it's okay. Okay, so what do we see as we're aging? Is it just wrinkles? God, how amazing would that be? A little neurotoxin and we're off to the races. There's so much going on, and there's so many layers to our skin, and in those layers we have different cells and they do different things, and one patient's cells are going haywire with some condition, and another patient comes in and it's a completely different problem. So really knowing that and understanding that to be able to do a customized approach is so very, very, very important. So we have sagging skin, we have wrinkles, we have roughness, we have larger pores and larger melanocytes that produce more pigment, so on and so forth. Okay, so you guys have probably seen this at some point, maybe not, but it's the V and the inverted V. V is, we can see, she has really beautiful facial fat. She has really nice fat around the eyes, giving her a youthful appearance, but she has no sagging of that beautiful facial fat. Now, the inverted V, when we get to that certain age, really everything starts to fall, but most of the time I would say, women especially, if you're looking at them and you go, okay, I can offer you, this is like, let's put ourselves in an event or an open house scenario. You're offering like one or this one. You can do your eyes or your lower face, what would you choose? And both are, kind of sagging. Do you usually get, or when your patients come in and they talk about something, first and foremost, the lower face? Is that typical for you guys? Not so much the eyes. So that is because that's where our eye goes. It's that prominent, now I have an inverted V. But if you look, you can see her eyes are starting to sag. That probably is affecting her vision. So it's not just the lower face, it's the full face. So we need to always remember that to address everything to give a youthful appearance. Now, not everybody gets this inverted V. Not everybody is going to suffer from this. And this is why. We have 3 types of aging. And I'm not saying that everyone's either a wrinkler or either a sagger. There absolutely is a combination. But most of the time, somebody will fall into one of these categories. Do you guys know what category you fall into? The 3? Wrinkler, sagger, sinker. I actually said that opposite. Sinker, sagger, wrinkler. Who knows exactly what they are, the main category that they would fall into? And if you're young, the category that you will eventually fall into. We'll all fall into a category. Nobody knows? This is so important because you need to know when you look across from that consult table what they are, because everybody is going to need a different approach to treating their conditions. And even, I think, as important, because we've been talking a lot about millennials coming into the practice, are you guys all doing a patient intake form, knowing how they live their lives? Do they drink coffee? Do they smoke? Do they exercise? Do they wear sunscreen? Do they, all the questions. Do you guys all do it? If you don't, you have to. And I would say, because you don't know, we want to give these amazing results, but when you look at that before a consultation and they drink and they smoke and they sun worship, and that's where it preps you for that consult, right? The results that they're going to expect may not be the results that you can give. But I would say one question that's really important to add on there, and you don't even have to put it on your questionnaire, but at least talk to them about it. If they're younger, do you know how your mom aged? Do you know how your dad aged? Do you know, any family members looking at them? Like, what was their typical, was there a lot of lines? Was there, loose skin? Because this will prep you on the treatments that you need to do even pre-juvenation to keep their skin healthy and strong. For example, if you guys have the Dermafuse, you can use that monthly for intensive hydration to keep the skin hydrated for those younger clients that are going to be a wrinkler. That's just one example. Okay, so my last PowerPoint was all about these. I can't fully go through it. I did a webinar on it if you guys are interested. But sinker it's, hollowness. We can visually see the loss of facial fat, but the biggest thing for them is that they are typically going to have thin skin. So yes, they can do a fat transfer, or you can add cross-linked HA to give a little bit more volume. Now it's more regenerative, right? We can do the bio-PRF to help fill the area, but you cannot forget about the skin. That's when they start to look fake, right? There's so much volume, but the skin hasn't been targeted. We have to thicken it. So for them, thickness is key. Sagger, that's me. Sagger. So, and I knew I was going to be a sagger. My grandma was a sagger. My mom was a sagger. Oily skin, typically, and I'm so oily, which is great. I probably won't have deep wrinkles, but something's going to happen, and it's that skin goes somewhere and it goes down. Most darker skin are saggers because they naturally have much thicker skin throughout their life. It's a natural thing because they have protection with melanin to keep their skin thick. So it's typically sagger. It's very rarely a wrinkler for skin type 4s and above. And then wrinkler, so this is going to be without any facial expression. You can smile and make lines, but without any facial expression, you can very visually see that she's a wrinkler. And who's her daughter? Is she a wrinkler? Yes. So there it goes. If she knew, she could start on that intensive hydration with Dermafuse and keep those at bay in a very natural way, in a very easy way, and no pain way. Okay, so now the reason why I brought this up, know what type of ager you have in front of you so you can address and use different technologies to give them the best treatment possible. Okay. Oh, and by the way, really quick, I know I'm going to go over time. I already know it. I'm on my second slide. The sinker, the wrinkler, the sagger, they can have a facelift. And I know not everyone's going to have a facelift in this world for sure, but they can get a facelift and it can look natural and beautiful. A sinker typically is not a candidate for a facelift. So they're going to have to come to you for rejuvenation. So just a little extra note there. And now that I've taught you guys this, you're going to be on a plane. You're going to be at the grocery store. My mom, when I had dinner and went through this with my mom every few days will text me, Charlize Theron is a sinker. Now it's in your mind and you're going to start analyzing. Okay, so this is my favorite thing to talk about. The approach we can take and the combination treatments we can do with all of the technology that you have. So I'm not going to fully go through this, just very quick overview. Pristine, diamond tip microdermabrasion. If you guys have watched any of our webinars, you are constantly hearing us say Pristine is a staple, it's a staple, it's a staple, it's a staple, because it uses vacuum and diamond tip to remove the dead skin cells, to remove a few layers of the epidermis, to get a better penetration of everything else you're doing. Because of the vacuum, it increases circulation to the tissue. What does circulation do? Brings blood and oxygen and nutrients to the skin, so you have healthier skin to work with. So microdermabrasion is key. Dermafuse, we talked about this earlier. We're going to talk about it a lot for the next 2 days. It is just the most amazing. It's a tiny little guy, but what it does is incredible. And you're going to learn more about that through the next 2 days. Not one person, when we do these events, they are so vocal with how happy they are with bringing it on. And the reason for that is how it boosts the results. They're typically not using it as a standalone unless you're going to treat melasma, something like that. But as a combo approach, it is phenomenal. And if you haven't tried it, try it. It's here today. And then, of course, all of our V-Series technologies. So now I'm going to kind of walk through how you can play and combine them. Okay, so when we look at her, what are we seeing? Just yell out some aging symptoms that you're seeing. Wrinkles, laxity, sun damage. This is good. You guys are interactive. I love that. So for her, and she may come in and say, I want to look younger. These wrinkles bother me. And it's you guys knowing it's not just the wrinkles, right? There's a lot of complex things going on that maybe she doesn't see or realize. So to make her look younger, it's coming at it with a comprehensive approach where, yeah, her wrinkles are gonna look better, but it's bigger than that. It's standing in the mirror and not this close looking at things, but it's standing back and looking at the mirror and going, wow, I look refreshed. Wow, I look 5-10 years younger, or people telling them that, right? So what are we seeing? We're seeing laxity and hooded lids. We're seeing fine lines and wrinkles. We're seeing solar lentigo. We're seeing texture problems. If anybody has fine lines and wrinkles, they will have texture problems. Absolutely. You need something to address the texture. A little bit of gelling, not bad, not horrible at all, but still pre-gel, you can get a jump start on it. And dull and dry skin, because our skin cells that turn over we always heard it, every 28 to 30 days, those are our keratinocytes in the epidermis. Those do not turn over every 28 to 30 days when we are her age. So it is absolutely going to be a must that there's gonna be dull and dry skin, but that's what like the Pristine and the Dermafuse are for. Remove the dead skin cells, boost it with intensive hydration, they're glowing and they look great. Super simple, 20-minute treatment and no pain. Okay, so now I'm gonna break down the skin and the cells. Not really the cells, but where are the problems originating? Those fine lines and wrinkles, where do we need to work in the skin? That texture, where do we need to be? Okay, so when we're looking at the epidermis, the dull skin is going to be superficial. The texture problems are going to be superficial in the epidermis. The solar lentigo is typically always going to be in the epidermis. Does anybody know why our sunspots are usually superficial? Our melanocytes, where are they? They're in the epidermis, and they're there for a reason. They're at the bottom of the epidermis. So the melanocytes produce pigment to protect the lower part of our skin, the main dermis where our collagen and elastin is. So it's producing pigment to protect all of that, so that's why solar lentigo, when they go haywire, the melanocytes are always gonna be a bit more superficial. Now, there's also times where it can be deeper in the dermis for sure, but it's a bit more rare. Okay, and then now we're looking into the dermis. Laxity and hooded lids are gonna be deeper. Papillary and reticular dermis in specific. Fine lines and wrinkles are going to be deeper where they originate. And then dry skin. Why is dry skin deep? A lot of times. You can see dry skin in the epidermis, sure. Dead skin cells makes it look dull. But why would the dry skin be so deep? It's because of and we don't talk about this enough in the industry. We talk about fibroblast cells, we talk about how they produce collagen and help strengthen elastin, and that's in the main dermis, right? That's why laxity, hooded lids, things like that originate. But the dry skin is due to the loss of glycosaminoglycans. Do you guys know one glycosaminoglycan? We have many in our skin. HA. So we lose a ton of HA as we age, and that's what's giving us that very dry skin appearance. Now, you heard a lot about the Energet and how exciting it is. It's actually able to take the filler, we hyperdilute it, so 9 ml saline to 1 ml filler, we inject it into the skin, and guess what? That HA is a glycosaminoglycan. So not only is it doing all the amazing things that the amazing doctors were talking about, it also gives us that hydration back. So that's why those before and after photos looked incredible. Yeah, we targeted the elastin and collagen. Yes, you are really transforming the cells to produce everything you need, but we're doing really deep hydration to the skin that lasts for a year and a half, so on and so forth. Okay, and then where are jowls originating? In the sub-Q, right? The subcutaneous. Jowls are two problems. It's if I just went in and tried to tighten the skin, if somebody has jowls, are they really gonna be happy? Most likely not, maybe a little bit, but there's still fat there, and that's a big problem, a big component to it. So we want to be able to shrink the fat cells in the area, plus tighten the skin. And with the V-Form, you guys can do that at the same time with the refit protocol. So quick and easy. Now, what's our combination approach to using our systems based on what skin layer are we in? So with the epidermis, big Prime the skin with the pristine, remove those dead skin cells, because all of that heat base that's going to go in after is going to respond better. Your light base is going to absorb better. Your RF is going to have a better penetration, less impedance, less resistance. So prepping the skin, getting rid of those dead skin layers. Then if they have solar lentigo, this whole combination approach is based on that woman that I was showing you, where we were seeing what she had. So she had solar lentigo, so you can go in with the IPL, knock out that problem area. Then the VFR for texture, right? She had a lot of texture problems. Then we can resurface. And I actually have the protocol on a slide coming up, exactly what steps you would take, all in one sitting, all in one day. And why we're doing this is we're making the patient incredibly happy for patient retention very quickly. One of these combo treatments, and they come back and they go, wow. Everybody commented on my skin. That's the idea. Okay, now the dermis approach to the skin, of course we can use the ST, RF, go in there, heat the tissue, stimulate the fibroblast cells for collagen and elastin, and then the V-form, right? The V-form is able to go into the fat, shrink the fat, and tighten the skin at the same time. Dermafuse, always to boost your results. So Dermafuse, you would use lipoalim to treat more of the fat in this area. You would use collagen booster if you need more collagen and you need to put ingredients into fibroblast cells that makes those fibroblast cells healthier to produce better collagen. And then so on and so forth. If they're a wrinkler, you would use probably intensive hydration because that's so important. So here's your combination. Here's the layout. Prep the skin, ST around the eyes, around the mouth, wherever they need it. Then V-form for the jowls, the submental area. Then the IPL, skin rejuvenation filter, rejuvenate all the skin cells plus knock out the pigment. You could also do the 530, it's up to you. Then the VFR for the overall texture. If you need to numb, I like to, as soon as I start the IPL, I will numb an area, do the IPL, take the numbing off, and then do the VFR. So I'm just moving, like I don't want to take too much time and stop and numb them for 30 minutes. So I'll numb in a smart way. It's where I'm treating. We can go over that more at lunch if you have questions on that. And then Dermafuse Collagen Booster. It's a beautiful combo approach. And this is kind of what to expect after the first treatment. You can see pigment's going to be gone. You can see texture is going to be improved. You can see the fine lines and wrinkles around the mouth are going to be better. You're going to see the jowls lifted. So that's the idea, them looking refreshed, them looking like themselves, but different in a good way. Now, a combination approach I did go over. I swear, Sergio, I'm going fast. So the combo approach doesn't have to just be for aging. It could be for everything you're doing. So here's an example I went over. I'll just have you guys take a photo of active acne and acne scars. And then at lunch, if you guys want to hear more about why we would do this combo, just come up and ask. Any of the trainers can walk you through it. And then before and after. Okay, so I want you guys to know, and then we're done and we're gonna be able to eat. Your bags there, inside you have folders, and somewhere in there we printed them for you, a ton of different combinations that we've created. And there's even more. We just picked out the most prominent ones that you would typically use, but we have more on our customer portal. So I'll quickly walk you through it. The sequential quick guide is, if I'm gonna use the ST and the Dermafuse, which one would I use first, before, after? VFR and IPL, which one goes where? Which one goes before which one? So that's that one. If you have a lot of our Sinclair technology and you're like, okay, this patient in front of me has texture, but I have a lot of options here, what do I do? We did a scale, good, great, and excellent. So if they have texture, you just go down and, okay, VFR is gonna be excellent, let's go with that. And then we have a face quick guide for any indication that you're gonna treat. Here it is to quickly get the results on them. We have different options for pricing, right, or time. And then body one, we have a comprehensive one, like they're going on vacation in 3 months and they want to look 10 years younger. This is the quick guide you'll grab, is the comprehensive one. And then if you have the Energet, we have phenomenal results combining the Energet with VFR and our energy-based technologies. So that's like a full treatment plan with the Energet. And then a visual quick guide. It's just the slides that I went through with you, so you can kind of visualize which step goes before one or another. All right, and then I can skip through I guess here's just an example. Even just the pristine ST and Dermafuse, what a huge difference it makes in just, 5 treatments. But this isn't even everything that I talked about, like really stacking it on top of one another. And then I always get the question, are you sure this is safe? Seems like a lot. I promise it is, because we're using different types of technology. We're not stacking IPL over laser and light-based over heat, and we're gonna burn them. It's incredibly safe. Of course, you have to consider, are they a skin type 4? Okay, I'm just not gonna go as aggressive with my energy, things like that. But yeah, you'll get great results. All right, now it's time for lunch, and then we'll come back in by the way, at lunch, enjoy the treatments. You guys can eat, get demos done, and then we'll come back. Thank you, guys.